most people
Linda, I suppose
would.
you've spoken to an awful lot of breast cancer survivors, and that is, like it or not, it is a big issue. Women are women at the end of the day, and like losing your hair, losing everything, losing your femininity, it's something that perhaps isn't addressed as much as the medical side of things.
Well, it was the one thing Mum said. She said, I don't mind being sick, I don't mind the treatment, I hate losing my hair, because she was a hairdresser. So, but then she would get wigs, and she was dyeing them and cutting them and knocking the sport out of it. And you do have to take the light side of it and enjoy it, you know, and take it for what it is.
Yeah.
But she did hate losing her hair. But I mean, I've talked to women who said, oh, when I lost one breast, it was great, because when I went in to get the reconstruction, I got the other one lifted. So she says, getting on in my ears, but I got it lifted. So, you know, it's great, and to take the positive side of it. And there's an amazing girl, actually, Katrina Lawler, and she's a plastic surgeon in Vincent's, and I heard her speak one day, and I always thought, God, if I lose my breast, I don't care, just let it go. But after hearing her speak, I said, Katrina, you can have my body any day, and it's great.
She operated on me. She's
Really,
fantastic.
really.
She's an amazing person. She really is.
Lillian, from your vast experience now at this stage, what difference does it make to have that sort of backup there, and to have the recognition of that we're all women at the end of the day? If you're suffering from breast cancer, you have to feel like a woman still.
I think it's just as the girls have said, it's probably the single most important thing that affects somebody diagnosed with breast cancer, is that their whole identity now is being annihilated, assassinated. And I suppose, just as Emma said, you know, having chemotherapy that isn't invasive, being able to live a life that's, you know, quite normal, albeit you're going through treatment and concern and worry, that seems to be singularly important for women. We ran a Survive and Thrive fashion show last week, and it really is about women surviving breast cancer and coming forward and very openly doing it. And most of the women that I spoke to actually would have made the same point. I hope you don't think I'm vain, but the worst part for me was really losing my hair. And it's not being vain, it's being very realistic and very practical. So I think it's really heartening to hear Emma's story, that, you know, apart from the car parks and the whole lot, but the fact that she could get through her treatment and still hold on to her beautiful looks as well is terrific, really terrific.
Okay, you can let us know what you think. You can call us 1513 99 99 33. You can text us, put the letters MD first, followed by your comments to 53131. So stay with us, see you in 3 minutes. You can call us now, 1513 99 99 33. We'll do our best to air as many as possible. You can also text us or Facebook us. The text line is MD first, followed by your comments to 53131. Loads of reaction to this item so far. And Aideen in Rathfarnham, she's at home watching. She has just had her first chemo last Monday. She's been through a week of hell, sickness and diarrhoea and severe cramps. How do you set yourself up psychologically for the next session? Emma.
Okay. First of all, straight away, as soon as you've finished watching the show, of course, don't turn us off, but straight away phone your doctor, phone the hospital, whoever is dealing with you, and tell them that you're feeling this sick, because there's no need for you to feel like that. You shouldn't be that sick, and there is medication there to help with that. I'm not saying that is wrong that you feel like that, but there's no reason for you to continue being so ill. So to tell your hospital or your caregiver and get some anti-nausea medication. And all I can say to you is, if you're feeling like that, that's as bad as it gets. It is as bad as it gets, and you know, if you talk to your caregiver and try and get some medication that'll help with that, that's great. The other thing is, we were just talking about in the break, there's a lot of therapy available as well, alternative therapies, and also you can have counselling and things like that.
Nicola, you had counselling, didn't you?
Yes, I did, and I found, I suppose, I had my surgery in October, this time 2 years ago. It'll be 2 years next weekend. And dealt with that fine. I suppose I was kind of looking ahead to Christmas. Our little girl had turned 1, and I was trying to get myself strong so that I'd be able to enjoy that. And I did, and I was great, and I was able to go to town and do my shopping and come home and go to bed. But in January, when I suppose the whole Christmas was over and everything was over, it just hit me like a ton of bricks. Thought I was doing great, and I just woke up one morning and I just didn't know how to kind of get on with it, and I couldn't stop crying. It was like, why me? Everything that I thought I would have gone through initially, and I didn't, and felt, oh, I'm great, I'm getting over this, and then bang. I went to a place called Arc in Eccles Street, which was absolutely fantastic, and I did go for counselling there, one-to-one counselling, but they also run workshops for all different age groups, and I went to one for younger women with breast cancer. I met people the same age as me, with the same issues, the same concerns. I just felt, okay, great, I'm not alone anymore. I was feeling so isolated. And subsequently, I still have friends from there. We meet up regularly for coffee. We just talk about positive things, and you know, it's great. But it's just so important, you know. Cancer can, you know, people do refer to it as sort of the taboo and all of that, and counselling can be the same, and it's just so important that you deal with it, and that you deal with it in your own way.
Being a new mother or something, and you go to a mother and baby group because, you know, you think, right, I have this new baby, I really don't know what to do. And you go to a mother and toddler group, or you go to little, you know, coffee mornings that are local, and you can meet people who live in your area, and you swap stories about what to do if the baby cries. It's the same thing if you have cancer. You know, it shouldn't be this taboo where people say, I can't talk about it. But if you're not coping, there is so much out there, and...
But for your family members as well, to go and speak to somebody. I mean, because they're sometimes afraid, like my brothers and my father. I was in the States when Mum was diagnosed, and they all rang me, Lil, what are we going to do? What's the story? And I'm like...
I know. And you don't have all the answers.
But I don't, but they couldn't go to Mum and talk to Mum about it. So they had to come to me. So, I mean, they need to be dealt with as well, people around you.
But it's just the whole issue of support, I think, that as Nicholas just said, is the importance of being able to talk to people who are in a similar situation as yourself.
And who understand.
Because they are the people who understand what you're going to. So I suppose just listening to somebody saying that if they're at home on their own, it's very important that they actually find out where that support is and reach out to it.
And we actually do this every year at Survive and Thrive. I get up and say my thank yous, but I say, you've come with your friends here tonight. Don't speak to your friends when you go back outside. Go out and talk to another woman, because we can listen to you and talk to you as your family and as your friends. But no, we do not understand what you've been through. Somebody who's been through the same thing. And it's great to have that network, and it really does work very well. You see it, Nicola.
And there is, there's various, I mean, different ways, but there's another, talking to somebody on the phone. I spoke to a number of people on the phone who were diagnosed as well before I had my surgery. And it was just great to... I remember talking to a lady who was pregnant with her first baby. She had been through her surgery, her chemo, her radiotherapy. Then she got pregnant and had a baby. And for me, that was just like, okay, so this can happen.
Amazing.
You know, we have one child. We, please God, we'll have more. And to talk to her and hear that was just fantastic.
And life goes on.
And it's just, you know, it's normal. It's like, great. This is...
Lillian, am I right in saying that about a third of breast cancers can be directly affected by lifestyle and your activity levels? I mean, that's something that perhaps isn't very well known. A lot of people would be aware of the genetic factors or familial factors, but I know that that's a big push that you have this year.
Yeah, I suppose this year, I mean, our message has always very clearly been around the importance of early detection, and I think the stories that we're listening to here are just an example of that girls who are strong or forthright enough to go and seek help when straight away, and I think that message is getting through. I suppose this year our message slightly changed in that it's about 20%, we say, of cancers are affected by lifestyle issues. So when Linda and I discussed sort of our campaign for this year, we said, well, if people are aware of the information, we all have a responsibility really for our own health. And if that message is, you know, you really need to look after yourself to protect yourself as much as you can from breast cancer, well, then we all have a responsibility to do that. So, you know, we very much focus on watching your weight, particularly sort of, you know, post-menopause, that you really look after your weight.
Because that's the highest risk age.
It is, yes, it is. It is primarily, I suppose, in over 50s, albeit here we are talking to young women, but statistically 70% of women who get breast cancer are over the age of 50. So we talk about physical activity. Everybody should be out doing their 30 minutes of activity, you know, a couple of times a week. Certainly the cigarettes and the smoking is a complete no-no. So, you know, there are things that we can do, albeit we know that there are risk factors that we can't do anything about. But if there are issues that are lifestyle issues that we can, well, then we really do have a responsibility as women to ourselves and to our families.
But even post-diagnosis, Emma, would you be very conscious now of what you put into your body in terms of antioxidants and your exercise and your health, or when you feel well enough to do so?
Yeah, well, I've always eaten a balanced diet, and I worked as a cook for one stage in my life, and so I know quite a bit about food, and I always cook from scratch, as the Americans say. I don't use
domestic
packet foods. Yeah, well, I don't know about that now, but so I'd be aware of food anyway. But you know, it's an issue, and it's something that a lot of people have said to me. You know, would you not totally change your life radically. Only eat raw stuff and, you know, stand on one hill and stick wave twice a week, because then you'll never get cancer again. And, you know, I've spoken to my oncologist, I've spoken to lots of people, I've done a lot of research, and certainly from what I've taken out of it is that a balanced diet and exercise, like I swim 3 times a week.
Just being healthy, basically.
Yeah.
Yeah.
And I hate exercise. I'm really very lazy. I just don't like it.
Linda, do you hate exercise, by the way? Because am I right in thinking you're running a marathon?
I am in New York, 3 weeks from yesterday.
Wow,
I am, please God.
Good for you.
Well, we did the first one the year that Mum passed away in '98. I went out and I did it, and then all of my brothers came over and did it the following year. But our ball used to always fall on the first Saturday in November, and we had our ball a couple of weeks ago. So I thought, here I go now. Here's my opportunity to go back. I think I'm mad, but it is an amazing feeling. Yeah.
Good God, how did you manage
Not
that?
as fast now. I'm not out to win it now. I'll just finish it. Just finish it.
Collapse after about it, I'd say.
It's an amazing thing to do, and obviously I'm doing it for the foundation. There's a team of us going out, and it's amazing to be a part of it, to see past people, and even with the women's mini marathon, you see it, and people and the reasons they all want to do it. I mean, it's not always a personal thing, you know. Somebody has lost someone to cancer, or somebody. I mean, I have seen people from a Chili's, which is disabilities, and people have lost a limb. I saw somebody run along with a prosthetic limb on them one day, and I thought, Linda Keating, move it. Don't be slacking off. So, I mean, it's fabulous to get out and do it. I'm looking forward to it.
Yeah, and are you conscious because your mum, obviously you're conscious because your mum passed away of cancer, but are you fearful now that that might happen to you, or like how often do you check? Is it always niggling in the back of your mind? Or
well, you'd always be aware of it, and I mean, and I do. I am very good with going to the doctors and getting myself checked. And it was actually funny because the first time I went for a mammogram, I just went because I had some mass tissue and they had to have a mammogram. And I called my brothers afterwards to tell them I just had a mammogram. Yeah. And Ronan says, oh, Jesus, Lil, I have to get something like that done. And I'm like, Ronan. But I mean, we would all be very conscious about keeping an eye on our bodies and doing the right thing, you know.
You can't help it not, I suppose.
Well, this is it, yeah.
Great. Well, call us 1530 99 99 33. Text us MD first, followed by your comments to 531. Stay with us. We'll be back in a few minutes.